Hey, everybody. Welcome in to PharmCast for the Community, sponsored by the University of Georgia's College of Pharmacy. We took a little sabbatical there so everybody could get their summer together, but we're back with the first one this August, dealing with the COVID vaccine, but also influenza vaccine. But before I get there, I want to remind you guys that we'll be doing these every month. And for September, we're going to talk about cholesterol management. We have Dr. Alex Schnibbing coming in, and she's going to discuss cholesterol, LDL, how to get your numbers down to make your primary care provider happy, but also make your heart even happier. So remember, tune in September. We're going to talk about cholesterol, the drugs that we use there, and also give you some tips of how to stay healthy and keeping those numbers lower, meeting those goals that we all know we should be at in eating healthy and exercising for our heart. Now, for August, back to a topic that I swear is on every media, every website, everything you talk about are vaccines, in particular the COVID vaccine. But I wanted to expand this month out because, as everyone knows, we're going into flu season. And so Dr. Ashley Hannings is coming on board with me today. Dr. Hannings is the Associate Director of Introductory Pharmacy Practice Experiences at the UGA College of Pharmacy. Basically, she helps program it when our students go out into the community in various settings to get some experience from their classroom into the clinical setting. Also, she's faculty trainer for the American Pharmacists Association's immunizations training program, which means she helps other pharmacists and technicians become certified in giving immunizations and counseling patients on vaccines. She also coordinates the university's mobile influenza immunization efforts. Man, there's a lot of I's in this. And does that for a lot of different sites across the state. Collaboration with the University Health Center here at Georgia. I know you've been talking to other groups across the state about their vaccine programs and immunizations. And I just cannot thank you enough to take time out because I know you're incredibly swamped, not only with talking about COVID, but also flu season's ramping up. And now we have this whole concept of both this vaccine for the flu and this vaccine for COVID, and people are unsure how that's going to really work. But I have to admit, as we go into the fall where everybody's asking about the flu vaccine, but before we get there, Dr. Hannings, do you mind telling us a little bit about where we are with the COVID vaccine? Because, there's just so much information.
Of course. And first of all, thank you so much for having me. So depending on when people listen to this, we could potentially say some things that are already outdated because things are just changing so quickly, both with our status with where we are in the COVID-19 pandemic and where we stand with vaccines as well. So, as far as the vaccine goes, we currently have 3 that are approved for emergency use authorization. 2 of those, have applied for full FDA approval, which we could see in the coming month. And so that's going to be updated. And then we're also seeing changes as well as far as who is able to get them. So right now, it only goes down to age 12, but that's not for all 3 vaccines. And so it's really just a completely moving target.
So, and I get it. The 3 vaccines are out there. 2 of them are 2 shots. One of them is 1 shot. The 1 shot is from Johnson & Johnson. I'm just going to use the names of the manufacturer, and I'll try to use a brand name here or there so people can understand. That one has been in the press a little bit more lately about not being as effective, maybe, as the other 2. As a pharmacist, do you recommend that we do the 2-shot series if at all possible? I know the 1 shot is easier. I know it is, but I'm just wondering, how do we protect our community?
Yeah, and that's a great question. And I think that there's a lot of things to consider when looking at these 3 vaccines because you're not exactly comparing apples to apples either. So the first 2 vaccines that came out, the Pfizer and Moderna, they're pretty similar to each other as far as how they work. And their clinical trials were done at similar time periods as well. And both of those ended up being highly effective for preventing symptomatic COVID, 94, 95%. Then Johnson & Johnson came out a few months later, and it was still effective and met that threshold, but it was much lower. So its effectiveness rate was closer to 70%, although that did get higher when you looked at cases of severe COVID. It was more like 85% effective in preventing severe COVID. A couple things to consider when comparing those numbers, though. One, the Johnson & Johnson trial was done later than the other two. And so it was at a time when we were seeing a rise in COVID cases. We were also seeing the emergence of some of those variants, like the one that came from the UK. So the virus itself looked a little bit different when those trials were done. And people probably had an increased risk of exposure. So, I wouldn't necessarily say that it's that much less effective. I think probably the more important measure to look at would be, do they all do a good job of preventing severe disease and keeping people out of the hospital? I think that's really kind of a better measure to look at. And one of the reasons why I point that out is because I did hear a story about a mayor who had essentially declined doses of the Johnson & Johnson vaccine because they said, well, I want to hold out for the better vaccines, which I don't necessarily think was the best decision. And he did end up taking it back once he kind of understood where those numbers came from.
Yeah, so the numbers can be deceiving. The take-home message is the vaccines are good in terms of effectiveness, and one is a one-shot, the other two, there are some differences, but you bring up a good point. I think, again, you can't turn the TV on about hearing about the virus is mutated or changed. Now, I know for those in the community, you may be like, what the heck does this mean? As a refresher, viruses change really quickly. The flu virus is a great example. It changes every year. We always have a sort of a new vaccine for the flu virus. So it's not uncommon for us to think that this COVID virus is not going to shift and move. And the newest one that's sort of taken the world by storm, unfortunately, is Delta. And I hear there might be a Lambda coming, and it sounds like hurricane season. We just name them by the alphabet. But with these vaccines that we have, how are they doing against the Delta, which is the one that I think is really taken over in terms of infection right now?
Yes, and that's a great question. And first of all, there's actually been like dozens of variants, but you don't necessarily hear about all of them. When determining, whether or not we need to be concerned about a variant, there's two general things that we look at. So we compare it to the original virus, or the wild type is sometimes how they'll refer to it. So we look at the current variant and how that compares, and we look at, is it causing more severe disease, or is it more transmissible? Meaning, is it spreading more easily in the community? And one of the reasons that Delta has emerged is because it is a lot more transmissible and spreads a lot more easily compared to the original coronavirus that we saw that was isolated.
Got it.
So that's why we're really seeing this big surge in the number of cases when we were seeing a decline as the vaccination rates were going up. Now, the thing that all three of these vaccines that are currently on the market seem to target is something called the spike protein, which really seems to kind of be the Achilles heel of the coronavirus. So far, the vaccines do seem to be holding up because the spike protein isn't changing enough to render them, ineffective. So vaccination is still definitely to your benefit. Although it's not 100%, so you potentially could still end up with a case, but you're much more likely to stay out of the hospital and have a mild case compared to those who are unvaccinated.
So, if I start with the Pfizer vaccine, I should end with the Pfizer vaccine, right? They're not interchangeable. We know that.
Correct.
So if I'm out there and I hear, Delta variant, it's not 100%, why should I even get this vaccine? Which is what I'm hearing a lot of younger people say. As we start classes here at University of Georgia, I worry a bit about, we're bringing all these students back to campus, and I'm hearing that population doesn't necessarily want to get vaccinated, or they just they don't feel pressure to get vaccinated. Getting vaccinated actually, even though it's not 100%, it's not black and white, it does benefit, right? I mean, at the end of the day, what does vaccination give us if we do come down with the virus? Why should we have gotten the shot, basically?
Yeah, and this is an issue that's come up not just with the COVID-19 vaccines, but with other vaccines as well, because you usually don't see vaccines that are always 100% effective, right? So why use them? Well, there have been vaccines that have eradicated diseases before, but that's not always a realistic goal for a vaccine. Really, the most realistic goal is we want to get it to the point where the disease is no longer a burden on the community, that it's not sending all these people to the hospital or killing a lot of people. So really, a vaccine can be an important tool in getting the disease to the point where it's under control. The flu shot, for example, I get my flu shot every year. I encourage everyone else to get it. The effectiveness varies from year to year, but you could be looking at, a 40-something% effectiveness rate. That's not to say that it doesn't have benefit, because it does prevent a lot of hospitalizations, a lot of flu-related death. And so really that's one of the main benefits is it makes the disease to where it's not causing this huge devastation on the community. So with young people in particular, to get back to your original question, their immunization rates are a lot lower in general than in older adults. And I think that's for a combination of reasons. Some of them don't necessarily see the value in it and think, oh, I'm healthy. I have a healthy immune system. I don't necessarily need it. I got exposed to COVID several months ago and I was fine then. But the thing is, there are a lot more young people who are ending up in the hospital right now, largely those who are unvaccinated. And that's because this new virus is just so much more transmissible. And so they just have so much more exposure. And so, just because nothing's happened yet, that doesn't mean that something couldn't happen to you. And you also have to think about those who you expose. So you may be around people who are older, have chronic conditions, who are more vulnerable to the virus and to those complications. And so don't just think about yourself and your own health, but also think about those you might be spreading the virus to.
That's a good point. I think the other thing that really sort of sticks out of my brain is, people said, well, I've had COVID, so I'm immune now. I got it. But it's like what you and I talked about. You were infected with one type of the virus. There's a brand new type of the virus out there. It's like saying, well, I've had the flu one time. I'll never get the flu again. Because I think that's hard for people to wrap their brain around, is that viruses change so much, as you talked about. And so just because you had it one time doesn't mean it's the same virus the next time. Viruses are mean little bugs, man. They just change it up. But you said something that really caught my attention. The effectiveness of the flu vaccine is, what does it usually run like? The effectiveness of the flu vaccine that all of us get most every year because we don't want the flu, quite frankly. So how effective is it again?
I'd say around 40-something%.
Wow.
But it does vary from year to year. So it doesn't sound great, does it?
No, but in comparison, the COVID vaccines are, as you mentioned, 75 up to 95%, depending on where you looked at the data and all that. But basically, we're saying 80 to 90% for the COVID vaccines being effective. We doubled the effectiveness of the vaccine, where with the current flu vaccines, we get about 40, maybe 60% on a good year. I think it's important for people to realize, as we go into this flu discussion, every year there's a group of people who sort of sit down and try to determine what viruses are coming our way for flu season. And usually there's 3 to 4 viruses they highlight, and then the vaccine is created trying to work against what they predict is coming our way. With COVID, the prediction's done. They know what's coming our way. I think that's why we see the effectiveness that's different. The flu sometimes is more of a gamble. But as you mentioned, even when we get at 40%, we've seen a reduction in hospitalizations, a reduction in death for both the older folks and for little ones like babies and young children. And we've seen less people have problems with their breathing, like people that have asthma and COPD and people who smoke. That's the same concept with COVID, right? That's why the vaccine works to keep us, excuse this term, healthier, but we can still get the virus.
That's correct. And one thing I'll go ahead and add, since you talked about the different strains of the flu shot and getting the flu shot every year. So there may be a little bit of confusion, because I know that things are still up in the air as far as if we're going to need COVID boosters, because right now they seem to be holding up against the different strains that we see versus the flu shot. We've been consistently getting that one from year to year. So a little bit of a difference there is, we don't have a universal flu vaccine right now. I mean, there are manufacturers who have been working on it for a while and trying to find a pathway. But the thing is, to have something that's universal that covers multiple strains, you have to identify something in the virus that does stay consistent from strain to strain and still makes a good vaccine target. And that's really been kind of the challenge with the flu vaccine, is they just haven't found a good target that's universal. So that's why we have to kind of change it up every year, is because we just haven't really figured out the trick. Versus with the COVID vaccine, it looks like that spike protein is remaining pretty much the same. And so that's why with that one, it's a little more effective for multiple strains versus the flu vaccine, which does tend to be more specific.
Got it. And that makes perfect sense. We know where to target, basically. Interesting, because, when you talk about anybody fighting a virus, if we're talking about HIV, herpes, chicken pox, anything like that, it's about trying to find that Achilles tendon that you talked about that we've discovered with COVID. But I guess the other question that has come up, you talked about booster shots with COVID. We're not sure yet. We don't know what's going to happen. But we do know that we boost ourselves every year, excuse this term, with the flu shot. I mean, we say, but we basically are giving ourselves a booster about every fall of every year to get us ready for the season. So for 21-22, I'm hearing words this could be a pretty rough flu season. But I have to be honest, last year, I didn't hear that much about flu at all. Was it hidden by the data on the COVID, or did we just not have a big season of flu?
We really didn't see very much flu last year. And, the thought behind that is, well, we were taking all these additional protective measures that we don't normally take during flu season. So, in many cases, we were wearing face masks indoors. People were much more conscious about washing their hands or using hand sanitizer. And so the thought is that a lot of that played into there as well and helped prevent a lot of flu cases, because you're right. The flu cases were the lowest that they've been in very, very long time.
I'm sorry. I know there are people who argue this, but take the COVID out of it, take everything out and just go, the flu season alone last year proves to me that if I wash my hands and wear a mask, I decrease the chance of transmitting whatever virus we're talking about, because that's the first time in the history I can remember where the flu just wasn't, you just didn't hear it, didn't see it, it wasn't out there.
Cases were very, very low. Like,
for those who don't know,
existent.
We can culture for the flu. There are ways that you can tell if somebody has that virus versus a different virus. So for anybody goes, well, how do you know it wasn't hidden in the COVID cases? Well, 9 times out of 10, there are ways to test and see what virus is out there when people come in.
Right.
So, this year we're coming around. We've opened things up a bit. I know we're remasking and some people are being asked to do that, but we are getting back to life in terms of people being face-to-face, family gatherings, holidays, and of course, students coming back to campus. How important is it that we get the flu vaccine this year, when it wasn't such a big deal last year?
Well, it's still important to get it because flu is still going to be around. And especially if we start to kind of cut back on some of those protective measures, that's going to put us at risk again. And so, we're still at a point, especially with the way that the cases have gone up with COVID-19 and the hospitalization, there's currently a lot of strain on the healthcare system.
That's a good point.
And so I think that's something we need to consider, is that we need to do everything we can to keep ourselves healthy and keep ourselves out of the hospital and others as well, because we've got multiple viruses that are going to be circulating. That's
a really good point, that if you're not going to get the COVID vaccine, at least get the flu vaccine, although I'm saying you get both. But at the very least, at the very least, get the flu vaccine, because you don't want to burden the system anymore. And I can't even imagine having the flu and COVID at the same. I don't even know if my body could take that. So as we go in the season, as a reminder, flu shots should start at what time of the year? Like, I'm relatively healthy. I like to think I'm in the older category. When should I seek out, at my local pharmacy or my primary care office to get my flu shot? What time of the year is the best time?
Great question. So kind of your ideal window is kind of September to October. So no earlier than September, but then try to get it in by the end of October. For most people, that is the general window. There may be some exceptions to that. So I know that actually some pharmacies are already getting shipments of their flu vaccine in right now. So it is available at some places. I would say for most people, it's probably more ideal to wait a little bit, just because the flu shot usually lasts about 6 to 8 months. And so if we end up getting like a late peak, like an April peak, if you get it too early, you might not be fully protected later on down the road, but you still want to get it into your system before the flu cases are on the rise at the same time. So it is a delicate balance. Some exceptions to, potentially getting it early might be, if you think that you might have some kind of issue with accessing it at a later date, if you're, say, a pregnant woman, because the youngest age that someone can receive the flu vaccine is 6 months. And so if you're pregnant, you may want to consider getting it a little early if it's going to make a difference, because you can give your unborn child a little bit of protection when they're first born, if they're going to be born during flu season. Also, young children, first time that they get the flu shot. They get 2 doses. And so with them, you could go a little on the earlier end because you've got to get 2 doses in. So there's a couple considerations for when it might be okay to get a little bit earlier, but the vast majority of people, September, October is where you should be looking.
Okay. And, I think that you bring up a really good point, because we know right now the vaccines for COVID are at 12 years of age and up.
Mm-hmm.
If your child's younger than that, you can protect them from the flu right now, 6 months of age and up. If it's their first time around, they get 2 shots separated by 4 weeks. I think that surprises people that, if I'm taking my 6-month-old in for the very first shot they've ever had a flu, they get 1 shot and they need a second shot about a month later.
Mm-hmm.
I was reading, and in what you said, sort of, it lines up beautifully with what I was reading, because it said by the end of October, you should be vaccinated, whether you're the kid with 2 shots or the adult with 1 shot. And I thought that was hilarious, because that's right around Halloween time when all the kids are coming by my house, sticking their hands in the candy trays. And I'm thinking, yes, because all those kids are bringing germs to my front door. This is the perfect time to get vaccinated or be vaccinated. When you talk about pregnancy, and what about those that are going through chemotherapy or those that maybe have HIV? Should they go early on, or is it okay for them to go in September and October as well?
I think it's okay for them to go in September, October.
Okay. Yeah, I think, because people want to say, well, what should I do? I've got this going on in my world, and it's a little different than last year if they're going through a health crisis. So that's important to note. So even though the pharmacies have the vaccines, you don't have to rush right now to grab one. You can hold off so it lasts all through the flu season, that 6 to 8 months you were talking about. You said 6 months of age for the kids, but there are different types of flu vaccine, and not all of them go down to 6 months, right?
That's correct.
I want to talk about community pharmacies in a second and the access that's out there, because I know that has been one of your biggest accomplishments in Georgia, is really pushing and making sure that in our communities, our patients have access to vaccines. But as a pharmacist, can we review what vaccines are out there? Because holy cow, it used to be like, we had one vaccine, everybody got it. And over the past 10 years, it's kind of blown up on the different ones that you can have or have available to you, I should say.
Mm-hmm. Yeah. And you may not have the same options from like setting to setting from a patient standpoint too, because, depending on the population that group usually serves, it may not be in their best interest to have this wide array of flu vaccines. So a lot of people can take any number of the vaccines, but there are some that have some limitations. So there's kind of your traditional one, which is inactivated, comes as a shot.
Hold on, inactivated, because
Yes.
I'm going to go back and ask this. That means it's just dead virus. It can infect you. It's making your immune system respond, but it's
Correct.
not giving you the virus, right?
That is correct.
Okay.
Yes.
Yeah.
Mm-hmm. Yeah. So with an inactivated vaccine, it cannot actually give you the virus. So that is an important thing to note. You could still potentially have some side effects just from your immune response ramping up.
I was going to talk about that in a minute. I was going to ask questions about what one should expect, but go ahead, please.
Yeah. But so you kind of have your traditional inactivated vaccine that's egg based. And so that one's been out there for a while. And in the past, you've kind of had options between how many strains were in it. So for the longest time, it was 3 different strains of the virus. That has since transitioned more into 4 strains of the virus that give you protection. And there could be differences from manufacturer to manufacturer as far as what ages those are approved for. So just make sure that you ask about that. So there's kind of the traditional one. There are also a couple options. You may have heard of like the cell cultured vaccine or a recombinant vaccine. So there are some that are completely egg free. Now, egg allergy is not as big of an issue as we once thought that it was. And most people who report an egg allergy do just fine with the flu shot. But if you did have some kind of serious reaction to either the flu shot before or to eggs before, you can use some of those egg-free options. Those aren't approved all the way down to 6 months of age, but those are on the table. There's also another type called the high-dose flu vaccine. Now, high dose is basically what it sounds like. It's a higher dose of antigen or a higher dose that's contained in there. That one's only approved for older adults who are 65 and older. The thought behind that is, as we age, our ability to launch a strong immune response tends to decline. And so if you give them a higher dose, you can kind of help boost that immunity a little bit more.
That response, right? It's interesting, Dr. Hannings, because I know it's indicated for 65 and older, but that's a great conversation to have with someone if you're going through chemotherapy or if you have HIV or if you're on a drug that lowers your immune system, because you can have that conversation to see if those high dose ones are something that's an option based on what your provider feels for your care. I think that's interesting that there's so many options for people to have that conversation where you point out it used to be just one shot. Now, if I'm allergic to egg, I don't have to worry. I can move over if I have to. If I'm a little older, I've got this going on. But there's also one that I think people ask about all the time because it doesn't involve you punching me in the arm with a needle.
Yeah, so there is also the flu mist or the intranasal vaccine. So that one, is one that does not involve an injection. It's given in the nose. With that one big difference is that it is a live vaccine. And so it's only approved for a certain age range. And really, it's more for people who are kind of otherwise healthy. So if you already have an impaired immune system, you wouldn't want to take the live vaccine because there's kind of you're at a higher risk for adverse effects. And so for those people, they would want to stick with one of the other options. But for like a relatively young, healthy person, the intranasal one is also an option.
So you've gone through this, and I have to admit, there's a lot there. If I were sitting at home right now watching this, I'd be like, oh my God, there's so many. So tell me about how community pharmacists have taken this under their wing, because this really has become it's just become a focus of pharmacy practice now. I mean, so many pharmacists know so much about these vaccines. How can I find out which vaccine works for me or what my local pharmacist has? Tell me a little bit about how that pharmacist is trained to work with the flu vaccine and other vaccines for our community.
That's a great question. And, this is something that's really changed in our profession over time because, a decade or 2 decades ago, you really couldn't you really couldn't get vaccinated in a pharmacy setting. And now you can go into almost any pharmacy setting and get vaccinated. And, I think one of the keys in putting us into that role is access. Right. So we're one of the only healthcare settings you can walk into without needing an appointment or anything like that. Easy access. You can walk up to the counter, you can call and get a healthcare provider right away. So, one of the things that I would encourage people to do if they're unsure about a vaccine or not quite sure what's right for them, just go ahead and ask. I mean, anyone who is giving immunizations has gone through a certain amount of training that's required. And so they should be well prepared to answer all your questions and help you navigate that discussion.
That's a great point. I mean, so I think a lot of people realize that pharmacists know a lot about medications and vaccines and those things, but there's extra training for those to give vaccines here in Georgia. So they know about what's out there and what would work. And, many times they may even call who you've been seeing as a primary care provider just to get a little information to figure out which one would work too. So engage your pharmacist. I was going to tell a story here, Dr. Hannings. It's amazing to me. I have a good friend who had not had the COVID shot yet, was unsure he wanted to do it, didn't know all that. And big, long discussion, finally said, you know what? I feel like I need to do this because I have asthma. So walked into a local retail establishment and within 5 minutes sat down, went through the paperwork, had the shot, picked up groceries while they were there and left. And I thought, you know what, if that had happened on a Sunday and you wanted to get into another office, another setting, that might not have been quite so easy. And I think realizing that you have those community resources in your pharmacist may make your life a bit easier, but also you have that resource who knows a great deal about these and can educate you. So even if you opt not to get it, at least you walk out with a little bit more information than when you walked in about the vaccines. Yeah. And that brings me to the point. What if my friend had said, you know what, I'm here. I should go ahead and get the flu shot too. I'm going to get the COVID. I now get it. I'm going to get it. What do I do about the flu vaccine? Can you get the flu shot and the vaccine against COVID at the same time? Or do they have to come back at different times? How does that work now that we're in this season of flu shots and COVID shots?
You can absolutely get both at the same time. And this is something that's been an area of confusion because that was not the case when the COVID-19 vaccines first came out. And really, so when they first came out, it was recommended to space them out from other vaccines by a couple weeks. And there wasn't necessarily any evidence saying that we had to do that. It was just that these were new. And so I think the CDC kind of thought, okay, well, out of an abundance of caution, let's just be on the safe side and space it out just in case. They've since taken that back because, really there was no reason to think that there would be any issue with them canceling each other out or interacting or anything like that. So now you can absolutely get both at once and you don't have to worry about the timing. It is recommended that, if you have the option to give one in each arm, that you do that, just in the unlikely event that you had some kind of local reaction. That way you could tell which one of the vaccines caused it.
Now, you mentioned local reaction. We'd be remiss if I didn't go ahead and ask. So I'm getting the vaccines.
Mm-hmm.
Am I going to have side effects the next day, 2 days later? And how do I know that the side effect is from flu versus COVID? Like, what should I expect, basically, if I decide to go do this?
Yes, good question. And some of the side effects do overlap with each other. Now, I would say that they do tend to be a little bit more common with the COVID-19 vaccines than with the flu vaccines, but a lot of them are similar. So number one, having a sore arm. Pretty much any injection you can get a sore arm from. It's fairly common in both, but especially in the COVID-19 vaccine, a lot of people have reported arm soreness. So that's one that you can get from either. A lot of the other side effects seem to be signs of the immune system kind of ramping up to fight something. So things like getting a headache, maybe feeling a little bit tired, in some cases feeling a little bit achy, maybe even a low fever. It shouldn't be like a high fever or anything like that, but a low fever is not uncommon to see. That's possible with either of these vaccines. It does tend to be a little bit more common with the COVID-19 ones, though.
Yeah, I think, when I was in practice, people would say, Dr. Brown, I'm not getting that flu vaccine again. It gave me the flu. And what it is your immune system is responding to that dead virus that's in there. Mm-hmm. And so you get like low level symptoms of what it would have been like if you got. So I just want to make sure people understand that the symptoms look real similar between the two. But I'll tell you, Dr. Hannings, that COVID shot, it did. It left a mark, as my dad would say. But, it did hurt. But I have to admit, after 24 hours, it did go away. I also have people ask me, can I move my arm around? Is it okay to do that after I get the vaccine? And there's some data out there that says you can move your arm around. You can even exercise your arms that day. And that actually would make the muscle hurt less in the next 24 hours because it sort of opens the muscle up a little bit so it doesn't get quite as damaged from the shot. I think a lot of people think, I can't lift anything or my arm hurts, or it's actually better to use the arm and it'll minimize that soreness that you may feel.
Yeah. And it's kind of counterintuitive because you may not necessarily feel like, lifting something with your arm when it's sore, but it can actually in the long run help you out.
Yeah. I was so surprised when they were saying that because I'm telling you, I was giggling at myself because I got the COVID shot and I went to bed that night and I'm going to tell you, I laid on my left arm and I went, oh yeah. Oh, there was a shot there today. And so I want people to understand that, yes, it's there, but it does go away within about 24 hours. And I did find it a little bit more than the flu shot in terms of hurting my arm. But I want people to understand the symptoms that you get after the flu shot is your body naturally reacting to it, which is good because it means your body responded. That's what I tell folks, that this is a good thing. Yeah.
And I think another thing, in addition to kind of having that lower level of, response, it also takes about 2 weeks for all these vaccines to become fully effective because your immune system kind of has to do its thing, right? And so one thing to keep in mind is if you get into contact with one of these diseases in between that time, you might not be fully protected as well. And so, I did have a conversation with a patient a year or two ago who was convinced that the flu vaccine gave her the flu. And we had a conversation about what could have caused those symptoms. And she said, there was someone at work who was sick with the flu right around the time I got the shot. I might have gotten it from them instead.
It's interesting. And I thank you so much. I think a lot of people in our day and age, like if I want something, I jump onto a website, I click it, and it's at my doorstep tomorrow. If I want to get my shot, I walk in, I sit down, I get my shot. Unfortunately, vaccines don't give you immediate protection as soon as the needle leaves your arm. That's a great reminder that it does take about 2 weeks for your body to have that response, for you to be, and excuse this term, fully immunized. I don't think anybody's ever fully immunized against anything, but for the full effect that's going to be seen to happen. We talked a little bit about booster shots earlier. I know it's still up in the air. I know that we talked a little bit about emergency use versus FDA, but our flu shots have been approved, right? They're done and said. Right. They're in the marketplace. So there's not a lag on those right now.
Correct.
And we're waiting to see if the COVID vaccines get FDA approval in the next month or so, correct?
Correct. Yeah. So flu shots ready to go. No delay there. When it comes to the COVID-19 vaccines, of course, things are changing every day.
Sure.
So, you've got Pfizer and Moderna that have submitted for full FDA approval. Johnson & Johnson isn't quite there yet, so I can't say when theirs will be fully FDA approved. But Pfizer submitted in May. Moderna is about a month behind them. So we could see full FDA approval as early as next month, probably I would say by the end of the year, but I know that they're really putting all hands on deck. The normal process, just to give people perspective, is when a vaccine or a medication or some kind of medical product submits for FDA approval, that's typically like a 10, 12-month process.
Right.
And then if they expedite it or give it priority status, you go down to like 6 to 8 months. So it's not a short period. So even for the normal processes is going to be on the faster end. Of course, I know a lot of us are really anxiously waiting for it to get done, though.
Yeah, I think people may ask, well, I don't want to get a shot in each arm at the same time. I want to do this separately. If you had to tell people right now which one to get first, what would you tell them to do?
If they want to get one of them first, I would go with the COVID-19 vaccine because that is the one that's currently causing the most devastation in our healthcare system.
So get that one out of the way. And maybe for your second COVID shot, you would walk in and get the flu and COVID at the same time, and you would knock it out and be done with it.
You could absolutely do that.
Yeah. I mean, I'm not trying to tell people what to do as much as I'm just trying to give you a thought in your head. If you want to start now and sort of avoid, having that sore arm as you get into Halloween and Thanksgiving, you could go ahead and start that process now and get it done. Dr. Hannings, I know you've worked a great deal in Georgia, training others and talking about immunizations, and you've done us a great service today by being here, and I want to thank you. If you could tell the community or our listeners 3 pearls from our conversation today, what would you have them take home from what you and I have discussed?
I'd say number 1 is protective measures like wearing a face mask, washing your hands. Those are going to help with overall disease prevention. And so I think regardless of what you decide to do as far as getting vaccinated, I think it's a good idea to try to keep some of those things in place. I think, second of all, I know that there's some people who are still a little hesitant when it comes to getting vaccinated, especially against COVID-19. And I know that there's stuff in the news all the time about this reaction was identified. I want people to keep in mind that, all eyes are on these vaccines right now, and they're being monitored very, very closely. So any little, anything that's identified, experts are going to look at, determine if it's a problem. And so if that kind of scares you, if you want to talk that out, please talk to your healthcare provider, whether that be a pharmacist, your primary care provider, or somebody else, because they can kind of help walk you through those conversations and really put things into perspective. If you're sitting on the fence about that. And I guess the third thing is, to kind of pay attention because things are changing all the time as far as where our status is with the virus and the fight against it overall, as well as, how we're using the vaccines.
Yeah. I think there's one thing you said to me that really struck home is this isn't about me. It's about my family, my dad, my nephew, the folks I come in contact with. So wash your hands, wear a mask, get the vaccine if you want it, but not just because you want it for you, do it for all the people that are around you. I think that probably is the thing that you said that really resonated with me, especially as we near the holidays and wanting to sort of be around people for those special times. Thank you, Dr. Hannings, for being with us. I really appreciate it.
Well, thank you so much for having me.
No problem. And for you guys out there, keep in mind in September, once again, we're going to talk about cholesterol, how to get your numbers. We have Dr. Alex Schnibbing coming in, who works in primary care and cardiovascular health, which is heart health. And she's going to tell us about statins, how to use them, and what the guidelines say we should be doing instead of eating that cheeseburger. We might want to have those celery sticks. So tune in, stay safe, and see you soon. Welcome back and enjoy PharmCast for the community from University of Georgia's College of Pharmacy as we ramp up our new year. Thanks again.